Today, we're going to talk about the importance of taxonomy codes. Not only are we going to learn the importance of the taxonomy code, but I'm going to explain to you how they're used by payers. My name is Dondra Edwards. I'm with Transition Acceleration Group. And at least multiple times during the week, I get a call about taxonomy codes. Either they're not sure which one to select, or they're getting rejections of their claims and they don't understand why. And we have to figure that out for them. And a lot of times it's because they have the wrong taxonomy codes. So today we are going to define the taxonomy codes. I'm going to tell you why they're important. And we're also going to explain why the payers find them to be so important and how they use them. So the first thing let's talk about is what is a taxonomy code. So a taxonomy code is a unique 10-character code that designates your classification or specialty. Now, as a consultant, I have my own taxonomy code. Chiropractors, dentists, spine surgeons, every profession has its own taxonomy code. So there's thousands of taxonomy codes out there. And today we're going to be talking about your specific taxonomy code for the dental industry. Now, who wants your taxonomy code? Well, in our industry, CAQH wants it. And they want it because they want a complete profile of the doctor and they want to broadcast that to all of the insurance companies to let them know what your classification is. Now, the NPPES, it also wants your taxonomy code. Now, one thing that a lot of people don't realize is that as a consumer, I can actually go to the NPPES registry and look for the provider and see what their taxonomy code actually is. I can also see any other information about their NPI number, their address, etc. So that's public knowledge, which a lot of people don't realize is out there and available for the consumers, but it will list your taxonomy code. And then the last is the insurance companies. The payers want to know what your taxonomy code is. They want to know what your specialties are and what classification you fall within. Now, how are they used in our industry? First of all, they're mandatory on the claims now. At one time, taxonomy codes was just a classification. Insurance companies didn't pay a lot of attention to them, but now they require a taxonomy code on each claim form. Now, what that does is it determines your specialty. And what I mean by that is that as a dentist, you have the ability to perform procedures, basically head and neck area, okay? And of course, of the oral cavity. However, as a dentist, you don't have the ability to perform other procedures like removing a lesion on a lower extremity. You don't have the ability to do spinal surgery, right? So if you are submitting uh, medical codes, CPT codes, to an insurance company for reimbursement, and the code was used by another specialty, immediately the insurance company would deny the claim because they will identify, based on your taxonomy code, you do not have the education or specialty in order to perform a spinal surgery or removal of the lesion of the lower leg. Now, if it's a removal of the lesion of the oral cavity, absolutely, but not of maybe the lower extremity. And so they determine what your specialty is as it relates to the code that is being submitted. Now, the other thing that insurance companies are doing is they have created a back-end code through their EDI department, which is for electronic transmittal of claims. When you send in a taxonomy code with your medical codes, your CPT codes, they will determine if they're going to allow you access to their claims processing in their medical database. Insurance companies no longer are sharing the dental database and the medical databases, even if it's one company. So Aetna still shares their dental database information on their medical database. However, United Healthcare no longer does that, and neither does Blue Cross Blue Shield. So you have to submit information to both of those companies to allow you access to their medical database. When you gain access to their medical database, if you are submitting the incorrect taxonomy code, they still will deny your claim. So it is super important in our industry to make sure that you're using the correct taxonomy code. All right, which one do I pick? Notice here we have several different taxonomy codes: dentist, general practice, public health, and then we have a list of our specialties. If you are a general dentist, you will select the first one for your individual NPI number. Now, you should already know that there's an individual NPI number, which is referenced as your NPI 1, and an NPI 2 is the organizational NPI number. So on your organizational NPI number, you can have the one that says general practice, and on your NPI 1 number, you will have dentist. You can also add additional taxonomy codes. So you can have more than one taxonomy code. That's not an issue on the NPI profile. Now you're probably thinking, well, what's all the confusion? I saw the codes, they're pretty straightforward. Why are there questions all the time about this? And here's why. So when you're looking at the definition of dentist, the definition is a person qualified by a DDS or DMD licensed by the state to practice dentistry. That is a no-brainer. That is a great definition. I won't read the rest of it to you. It's a great definition, and it says you are a dentist. But here is where the confusion comes in. There's so much documentation out there that says for general practice dentistry, and it's the 1223G number that we're seeing here. The definition is a general dentist is a primary dental care provider for patients of all ages. So the definition makes it sound as if it is an additional code for a general dentist. A general dentist using this code on their NPI 1 number will not be able to access medical database information with Blue Cross Blue Shield specifically, and a few other larger commercial payers. They will not allow it because this is for general practice. This can be attached to your NPI 2 number. Now, the ADA also states that the general code of the 1223 code, which is the first one there identified as dentist, can be used instead of any of the other codes. So, when you are doing your NPI updates, I want you to go to the NPPES website and I want you to look and see what your taxonomy code is listed. Under your individual taxonomy code, you should be listed as dentist 1223 00000X. That's the taxonomy code that you should have as your primary taxonomy code if you are a general dentist. Now, if you perform oral surgery in your office as a general dentist, I also could add oral and maxillofacial surgery taxonomy code. If I perform root canals in my practice, you also could select the endodontics taxonomy code. So you can have multiple taxonomy codes, but your primary needs to be the dentist, not general practice, the 1223G taxonomy code. If you select the 1223G as your taxonomy code on your individual NPI number, and you are filing medical claims, and specifically right now, Blue Cross Blue Shield is the primary payer that does not like this taxonomy code, but others will soon follow. you're creating a lot of additional work and denial on your claims. So do not attach this taxonomy code to your NPI 1. If you do attach the wrong taxonomy code and you're submitting claims, you potentially will be getting rejected claims. Of course, you're going to get delays in payments because the claim will not be adjudicated. It will be immediately declined or rejected. And not only that, is the payer will deny you access to the medical database. Now, what do I mean by medical database? I've referenced it a couple times in this video. Whenever you are filing CPT codes to medical insurance, they process you under a different database. Oftentimes, we have to ask permission for a dentist to be included in that medical database. And so they separate the information based on CPT codes or CDT codes. So the CDT codes are dental codes, and the CPT codes are medical codes. It's information about allowing you access to file claims to those different insurance types. So that's what I mean by the medical databases. So again, make sure that you are using the correct taxonomy code. And it is not the 1223G. That taxonomy code does not need to be attached to your NPI 1 number. All right, that should clear everything up for you. Thank you so much for your time and attention today. If you would like additional information, please contact me at dondra@transitionag.com.